already
Now
Now
you're just all in.
for the time being.
Except for control.
Remember, it's invisible, and so you don't necessarily know where you picked it up. Just like I read in today's paper, there was a young woman locally who has gone on record with this.
Double angle markers?
Yeah.
Oh yeah. Just for not separate, just for better.
Other B-roll.
So she's sharing.
Because we have to live stream. So, I mean, you know that.
Yeah.
It's just them being extra.
Yeah.
That's what it looks like.
They'll probably have to go to the podium, Paula.
Yes.
Where will Julie be speaking?
So Julie would be having my daughter drive my mom's car.
And I would say that, how about we have you sit on this side, or one side or the other, and then when Jen calls you up, you
Julie, if you
will
just
walk
wanna
up there,
come
but I
to
want you
here.
to not have to trip over.
Yeah, or there's a chair right over there.
So,
I'm gonna stand on the other
you
side.
know
of
Jen,
the
right?
Yeah, so yeah, coming over here is better.
Oh, perfect.
Oh, hi.
Yes.
How are you?
Good. So that's NELSON, right, Julie?
Correct. Yep. Okay. Julie. Yep. NELSON.
And you are privy to
I'm giving you
her
a sign.
announcement of the donation area.
Yep,
gonna be
I'm just
look
gonna,
for-
I'm gonna
Right.
step down and I'm gonna let you step
Yes.
up and talk.
So we do have a
And you're with
stool,
great reverse today.
if you want to stand on it, but that may make you.
I think we will ask you to do that because, I'm gonna be up there. It makes sense that you would be up there. When I step down, you'll step up.
Okay.
Okay, so you'll take my cue.
Okay, so if you want to do that. You want a chair, or are you okay leaning against it? It shouldn't hang up on you.
Just
Have that
because I
anyway.
don't-
Don't go a lot, it's like-
There's always gotta be some humor in it.
Thank you. You guys let me know when you're ready.
Have you taken a picture of this process at all since we started? Okay, I just wanna make sure that we have, photos for our after reaction and our annual report.
And then are you doing the?
You know, everyone's
Walk
like,
Runner
Yeah. So you can,
And you
you're
were
good.
doing
I'll just do that.
an amazing job. I'm really impressed.
You know you're gonna be one. No, I said, well, you are.
Welcome and happy Friday, everyone. My name is Jen Rumbalski, and I am the Health Director for La Crosse County Health Department. Glad to see you again today. I'm going to give a case update and let you know what the situation is, both at the state and the local level. And then I'm going to ask Julie Nelson from Great Rivers United Way to come up and talk a little bit about masks. Then I'm going to give a little bit of an overview of some other announcements that I think we should just make the public aware of. And then as always, I'll take questions and answers. So to start with, the state of Wisconsin today now has 842 cases of confirmed COVID-19. That is an increase of 135 from yesterday. We have at a total of 13,140 negative test results, and that is an increase of 1,557 from yesterday. In addition, we have 13 deaths in the state of Wisconsin, and that is an increase of 5 deaths. And at this point, I want to pause and say that we know that all of us are within 6 degrees of separation of anything that's happening with regards to COVID-19. And I'd like to share that one of those deaths is someone that I knew. And though I haven't been in recent contact with that individual, so I just want to make sure folks don't think that I have an exposure level. It's tough to hear that, and those numbers are real. So I think it is a way for us to be aware of the severity of this situation for our state and our nation. Locally, we have 3 total cases recovered, so that is up 1 from yesterday. I'm very happy to announce that. In addition, we have 1 new case, and that is in a female in her lower 50s, again with mild to moderate symptoms, so thankfully not severe. We still have no hospitalizations in La Crosse County for our residents, nor do we have any deaths. and our total currently is at 15. I want to briefly go over, just to remind all of you, that the way that we get cases by county, remember that while we have health systems in our community and there are health systems in other communities, that the cases go by county level. So we report specifically for La Crosse County, and then each county around us would report for their own residents in terms of numbers of recovered cases, numbers of confirmed cases, deaths, and things like that. So I just want to remind individuals that we report specifically for our own residents. So at this time, I'll step down and I'll ask Julie Nelson to come up and talk about masks.
Good afternoon. There have been a number of our residents who've been very interested in helping in whatever way they could. And one way that they would like to help is to sew masks for our healthcare workers. If people would like to do that, we have a way for you to drop those off. Now, first of all, I want to say that we hope that we will never ever use those masks. They are not the kind that we want our healthcare workers using. We want them to use the kind that the manufacturers make that are really good and will do a lot to protect them. The masks that you can sew at home are going to be better than nothing, but we hope that we'll never use them. That being said, if you would like to make some masks, please go to yougetconnected.org, so that would be www.getconnected.org, and you will see a big bar that says the COVID-19 response, and on there you will find a link to the instructions that we would like you to use to make these masks. And that will make these masks as good as it be possible to get them. So if you have the materials at home and you would like to sew a mask and you can follow a pattern, which I for one cannot, then please go ahead and do so. There's also a good drop-off point. The City of La Crosse has set up a drop-off station at Isle of Plume. It's open Monday through Friday from 8 a.m. to 3 p.m., so you can take your masks there. And we've also seen some inquiries from people who said, oh, I saw this other pattern for a mask and someone else made this, could I use that one? We're going to say no, please use the pattern that we have put out there. It'll just make it that much easier in the end. Let's say we get 1,000 masks donated. It would be almost impossible to have someone go through each and every one and make sure that that is an appropriate one that can be used. So if everyone uses the same pattern, that will be a lot easier in the end to make sure that these masks could be used by someone who needed them. You'll also find on that You Get Connected site, if you would like to be involved and help some people going through this epidemic, that we have a letter writing campaign going on. So you can write letters to people in nursing homes. And now RSVP has joined us with that effort, and they would like to have you write letters to their volunteers who usually do a lot but are now isolated at home. So this is a way you can reach out to some individuals who are at home. This is a great activity for individuals, for families. You can write cards, letters, anything along those lines. So again, yougetconnected.org. This is a website for a lot of volunteer opportunities in town. Great Rivers United Way is a part of that, as is UWL, Viterbo, and Western Technical College. Thank you.
Thank you, Julie. She is such a good speaker. I also want to just remind you all that, again, please don't go out to get additional supplies to make these masks. Just a friendly reminder about that. And thank you, everyone, for the support that you're trying to give with regards to this situation. We very much appreciate all of those in our community who are really trying to do their part to include this. So a couple of announcements at this point. First of all, I have talked briefly in the past about the personal protective equipment program that the state of Wisconsin has been working on to do buyback of PPE in our state. So that press release came out late yesterday. The State Emergency Operations Center, or EOC, will work to distribute supplies that are provided. So they are looking currently for donations or anyone who is willing to sell any personal protective equipment that you have available. The website, if you have any of those supplies, is covid19supplies.wi.gov/donations. Right now, they are specifically looking for certain supplies, and the list includes surgical gowns, face and surgical masks, both adult and pediatric, gloves, either nitrile, vinyl, or butyl, N95 particulate respirators, isolation gowns, face shields, Tyvek coveralls, thermometers, and foot coverings. The second announcement is that the Wisconsin Department of Natural Resources has announced that all state parks, trails, and forests are open and fees will be waived. So they are recognizing that we need to be outside and having good physical activity. I have seen lots of people out running and walking their dogs. It's wonderful to see. Those are great healthy activities. Do just keep in mind the social distancing aspect remains in place, and all regulations relating to hunting, trapping, and fishing also remain in place. The third announcement is in regards to racism. We have heard about reports both locally and across the state in regards to Asian Americans being treated inappropriately. Please let's remember that these are fellow human beings. They are not aligned with COVID-19, and we need to be very careful about how we treat each other. Kindness is so important, and I think I've said it before, but kindness is critical. So let's please keep that in mind. I myself have Asian Americans in my family, and I just think we need to be careful about how we treat each other in this time. And then lastly, just to note that there are a lot of fraud calls and emails going around out there. So please know you need to be careful about some of these emails and calls. The same rules apply. If you are not sure who someone is that's contacting you, take caution. Do not give out credit card numbers, things like that. We really want to protect your safety in many ways throughout this whole experience. So that is just another thing to be aware of. So those are all of the announcements I currently have. Questions and answers at this time.
If someone's experiencing symptoms, do you guys recommend they take Tylenol, ibuprofen, or regular aspirin?
So the question is, if someone's experiencing symptoms, should they take Tylenol, ibuprofen, or something else like aspirin? So I think that the ruling is still out on this. I was on a healthcare call this morning, and there is one study, I believe, that's talked about ibuprofen. And I think what I would recommend at this time is that starting with Tylenol or acetaminophen would be the best plan of action for things like fever, muscles, aches, and pains. If that is not effective, then certainly you could use ibuprofen. But the recommendation right now would be to start with Tylenol or acetaminophen.
We're at case 15 now in the county. So now that we've reached this point, what do you think the health department has learned so far, and what do you anticipate happening in the future?
So we're at case 15 in La Crosse County. The question is, what have we learned so far, and what do we anticipate in the future? We have learned a lot, and I can say in particular we have learned how critical it is for us to be working together. So I think we need to continue to do that. We are always looking ahead to see strategically where might the next concern be located. We think about specific populations in our community. We think about those that do not have a home and are homeless and the risk level to them. We think about those that are over 60 and or have immunocompromised systems or underlying health conditions, and how can we protect them. We think about healthcare workers and wanting to make sure that we can protect them as well. They are a huge part of our population. So we have learned that partnerships are critical. They're working really well for us right now, but we can always improve that. And I think we need to continue to be ready for the worst case scenarios and hope that those do not come to fruition. And so far, I think that's going very well.
Are there any new symptoms you guys are seeing, or ones that people should be on the lookout for?
So question is, are there any new symptoms that we're seeing or anything that people should be on the lookout for? No, it's been fairly consistent. We do see a variety of symptoms. So not everyone starts out with a cough, for example, but many do have a cough. We also know that muscle aches and pains have been a common symptom, and just a generalized not feeling well to start with. So I think that's why we have to continue to be careful about when symptoms begin and making sure those mild symptoms are that we're recognizing those immediately, because it could start with a headache and muscle aches and then progress to the cough. So it's been a little different for everyone, but those typical symptoms we've mentioned before, the cough, the fever, the headache, the sore throat, the body aches, the difficulty breathing, are all still symptoms that we'd be watching for.
What directions do you give people with confirmed cases of COVID-19 when they're clear?
So the directions that we give to people with COVID-19 once they're cleared. So just to remind that the definition is when someone has diagnosed COVID-19, they can be cleared from isolation when they are at least 7 days from the start of their symptoms, and they are at least 72 hours symptom-free, particularly fever-free. So what we tell them is then they are now part of the general messaging that we give to everyone, which is that now is the time to stay home. And also that, you know, if you're doing essential travel, that we ask you to keep that to a minimum, that we ask you to protect yourself when you're out and about in the community doing that essential travel to get groceries or pharmacy medications. And that just like everyone else, if you need to seek medical attention, that you call first.
And can you explain how that's different than the 14-day self-quarantine recommendation?
The question is, how is that different from the 14 days when they're isolated at home with symptoms? When they're isolated at home with symptoms, we ask them not to leave the home at all. So essential travel would need to be done by someone else in the household, but they should not be out in the community at all.
We have 2 Facebook questions. The first is if you know this new case is from community spread.
The question is, do we know if this new case is from community spread? So we don't yet know that. We are early in the investigation process with this new case, and nurses are currently making those phone calls right now.
Okay, and then the second was, why is it if a person might be treated at a local La Crosse hospital, do we share that information or do we not, and why?
So the question is, if someone is treated at a La Crosse hospital, do we share that information and why? We do not share that information unless they are a La Crosse County resident, because again, just as I said before, we report by the county of residence. That's how cases are reported. That's how deaths are reported. So we know that healthcare systems will treat from a large region, a large area. So we just need to that has always been the protocol, no matter COVID-19 or any other type of disease investigation. It goes back to the county of residence for that particular individual.
Yesterday, I know you highlighted the start of the investigation when you talk and do the contact tracing. What does the relationship look like between the health department and those that test positive after that? I'm sure there's still communication.
So the start of the investigation, can you repeat it, Haley?
Yeah, kind of like what do you guys do after that? I'm sure you guys
sure.
still contact them. It's not like you're done.
Okay, so the question is, after we start that investigation, we have that initial conversation with the client, what does that look like afterwards? So we do routinely check in with those patients, and it's helpful for us because we want to see if their symptoms are getting any better, any worse. So for example, you know, if we have an individual that we know has underlying health conditions or they are in a population age group that would be more concerning, we want to make sure that they're not getting any worse. So we do check in with them regularly.
If state parks are open, is travel to them considered essential travel?
So the question is, if state parks are open, is travel to those parks considered essential travel? So that is a very interesting question, but what I would say is that we need to balance that out. Just like when we might go outside our home and walk about the community, it is really about both your risk and the risk that you might transmit to someone else if you come down with symptoms of COVID-19. So we are allowing people to do that kind of travel to a state park. We need that kind of outdoor activity, but that doesn't mean that you stop along the way, that you bring individuals that might be symptomatic on that trip. We still take all of those same precautions, and it doesn't mean that you travel across the state to get to a state park somewhere else in the state. It means that if there's a trail nearby, one that you would like to walk on to get physical activity, that is understandably okay. But remember that we need to make good decisions about where we're going and why we're going there. And I think We just need to be smart about where we might be potentially exposing ourselves or others.
If people don't have
So if someone can't afford or doesn't have a primary care provider or can't afford going to urgent care, there have always been backbones to this community and many others for those types of individuals. And a couple of those resources include places like St. Clair Health Mission, our free clinic in town, and also include our emergency room, so that if someone really does have symptoms, they need to be seen and they don't have another mechanism to do that. Those are locations where they can go, but again, call first.
If someone is coming back from travel, like Florida or another location or another state, should they be self-quarantining?
The question is, if someone's coming back from another state, including Florida, should they be self-quarantining? Yes, they should be self-quarantining, and that means you should not be going out and doing essential travel. It would be similar to if you are in isolation. What happens there is that you may begin to experience symptoms, and we don't want that to start while you're out in the community somewhere doing essential travel. So yes, quarantine would be warranted in those situations.
When people kind of hear nationwide that there's a shortage of tests, are you able to speak on if that's the same case for Mayo and Gunderson?
So the question is, do we have a shortage of tests locally with Mayo and Gunderson? So what we are doing is we are strategizing where those tests go. So I can't say if there's a shortage of tests, more that there's a strategy in place to assure that the testing supplies we have are going to the right places. So if we were to open that up beyond strategies, for example, then it's very, very likely that those that really need to get tested, like let's say, if a healthcare worker gets exposed by someone that might have COVID-19, we need to make sure that that patient didn't have COVID-19, or we need to be rapidly addressing that healthcare worker. Or if someone is at serious risk of complications from COVID-19 or even death, we need to know if that patient has COVID-19 so we can assure that we're ready to rapidly respond to that potentially quick deterioration of patient condition. So I think there's a lot of factors that go into play, and I don't know that it's necessarily a shortage of tests, but there is not an abundance of tests, and we need to be really careful about having a good strategy in place to make sure that they're going to the right place. And just again, we don't need a test to know what to do.
Following up on the coming back from a different state, would you isolate it for the 14 days then, or would you isolate it for a lesser amount of time until symptoms are there or not?
Right, so the question is, if they're coming back from another state, you would quarantine for those 14 days. And that is because the range of symptoms can happen anywhere in that 14-day period. So yes, the recommendation would be if you're traveling back from another state, you need to be in quarantine. We say quarantine because that's not yet, you don't have symptoms. So once you have symptoms, then we would be talking about isolation. So quarantine would definitely be warranted for the 14 days.
Is there a shortage on medical supplies? I've noticed it's hard to get your hands on hand sanitizer and masks.
So in terms of personal protective equipment and the amount of PPE that we have available, including hand sanitizers, masks, things like that, we are concerned about having enough of those. We are hearing locally there is not currently a shortage. However, at any given time, that could become a very concerning situation if we were to have a number of patients that required care, for example, that meant routine changing of personal protective equipment. So I think that is why the state has recognized this as a need and is putting out this buyback program to make sure that they can be bringing in as many supplies as possible, so we don't have to be stringently rationing PPE. That is not the ultimate goal. We do not want to find ourselves in a crisis situation where healthcare workers do not have the appropriate PPE even when caring for patients that have COVID-19. So we are very concerned about that, and we talk about it every day, and we are continuously assessing and trying to determine the need and the supply and making sure there's a match. Thank you all, and have a great weekend.